webinar presented today. My name is David Antleys. I am the Director of Networking Services for Maron Structure Technologies. Again, welcome. What we're here to talk to you today about is the paradigm shift that is mobility in the healthcare industry. A couple things I'd like to talk about. First of all, regarding this presentation. One of them, in the interest of full disclosure, we are a Juniper partner, also a Avaya and Aruba partner. We also are a managed services organization along with professional services. So at the end of the event, if you have any questions, please feel free to ask of Diana. Also, we will have some email addresses for you at the end and some URLs that you could follow to come and visit us on our website. And if you have any more questions after the event, you can address them to us from those URLs or from our email addresses. Okay, the mobility healthcare boom in healthcare. The healthcare industry is growing through a transformational period. Mobility, bring your own device. Basically, the paradigm is many organizations are now allowing for mobile devices to be added to their collective unit, so to speak. Basically bringing in your tablets, your smartphones, laptops, what have you, into the organization, whether you're a clinician, physician, whether you are nurse care or nurse aide. These are services that are now being allowed, and it's posing a lot of interesting issues for practitioners and administrators out there in the healthcare industry. Devices and applications are driving the way to patient data and clinical systems, the way they're accessed, and the way they're transmitted and delivered. There's a lot of things that you need to consider when you are delivering these types of services to an edge device such as a mobile phone or a tablet. Today, nearly 1/3 of all healthcare providers use mobile devices to access EMRs and EHRs, and this, of course, drives a demand for a more sophisticated and more defined way of delivering the applications. And not only that, but also securing the applications. The digitizing of sensitive patient data is also well underway, and this is making the need, as I had mentioned earlier, the need for a much more stringent security policy. So new models are possible: collaboration, telemedicine, electronic health initiatives, transform healthcare delivery and outcomes each and every day. I see it every now and then when I visit my doctor or when I have visited my daughter's doctor. The different types of technology that they're using to access the patient records. So basically, a lot of this is driven from HIPAA and privacy rule as far as the security aspect is concerned. Basically, if you are relegated to some form of governance, in which most healthcare industry is, you have to make sure that the patient information that can be readily accessed is protected in such a manner that, one, you're able to identify who accessed the information, two, you know when the information was accessed, and three, you know that the information that was accessed is secure. In many the applications that you're using. And in many cases, you're not even really aware that, one, you may be using a device that you're already using for home as opposed to just using for a specific purpose, that being for healthcare or accessing data. Data access. So these are the challenges that the industry faces. Data access anytime, anywhere, by practitioners. Again, clinicians, physicians, nurses, at home, at-home delivery, care services, dental services, what have you. Any of these services that are basically out and about, either from a delivery aspect of service or a delivery aspect of physical information. These are topics, or these are the buckets that need to be secured, access to the sensitive data, patient records across public services, whether or not you're using a public service such as a 3G or 4G connection, or if you're using Wi-Fi. Applications galore using myriad of devices to access sensitive data. Again, the proliferation of many of the mobile devices causes a little bit of an issue, especially when you can't settle on one specific device. When you are trying to secure your information, it's usually helpful when you have one bucket of device, one type of device. But when you have to maintain and manage a myriad of different devices, it becomes increasingly difficult because one, the operating system is different. Two, the way the application behaves on the device is different. And three, the way the device delivers the content is different. And further adding complexity to this is the BYOD. So now you're having your constituents, your user base, bringing in their own devices, and this is becoming more and more prevalent as as increasingly apparent that this trend is not going to stop anytime soon. Another nightmarish scenario is provisioning management. So how do you make sure that now you have these devices on your environment? How do you provision the applications that are on your environment that are required to be placed on these devices? How do you deliver the useful, the thought-provoking application that will work day one out of the box and not provide a kludgy or a useless sense of user experience? Usually these are the topics that kind of weigh down on the network administrator, because you think you're delivering the service appropriately, but at the end of the day, a lot of it also is subjective. So if the content delivery is not there, and when the user is using that application and they feel that the service is not 100%, you run the risk of having them either abandon it or try to find a workaround. And again, content security. Who has access to what and when? These are topics that you really must address when you are going after this mobility paradigm. Again, security thought to be adequate and scalable using current techniques and methods. In many regards, it is not the case, simply because mobility offers a different way of access and a different way of working around different security mechanisms. Again, if you don't have an idea of what is on your environment, or if you don't have an idea of what can potentially be how that device can potentially be used apart from the specific use for which it was provisioned, then you might have a problem down the road. This is not a scare, this is doom and gloom. It's just the reality. We are very carefree society when it comes to devices such as a iPad or an Android device or what have you. They're just instant on demand applications. Application devices, and these devices are meant to access your information right away. Your expectation of your user base should be, I want it on, it's going to turn on, I can look up the information, but the last thing they're thinking of is whether or not it's secure. That is the job of the administrator or the engineering department in the IT firm whether it be a hospital, doctor's office, or what have you. So multiple security mechanisms, too much to manage. How do you maintain policy in a cohesive state when multiple parties are involved? Again, you have to think about, now I'm trying to administer not only my data center and also my laptops and my desktops, which are currently at times a pain to manage, but now you got to manage these mobile devices, and now you have different multitudes of solution sets that you could possibly use to manage all of this. But at the end of the day, if you're working with less is more as your business model, it becomes difficult to manage all of these pieces at once. Let's take a look at SaaS for application access. So you're using the cloud to provide and provision these services. Who's managing that service, and who's managing the security at the endpoint? Do you have a cohesive, do you have a very stringent security policy that, one, when you're deploying these services, do they mirror what you have today in your data center, or are they an offshoot? Virtualized environments introduce another level of complexity. Now you have all these environments that can easily be moved and transcend between sites and data centers, but again, who's minding the field? Who's watching the kernel? Who is looking at everything that needs to be secured from a device? Again, you're talking about virtual machines working in a virtualized environment, but you're basically, in the traditional sense, you're watching it from the outside with your physical appliances. Now, while you can apply certain ALGs or certain security policies and intra-zone policies, you don't necessarily have that visibility inside the virtualized environment to make sure that you're 100% protected. Now, let me paraphrase this and backtrack a little bit with the 100%. Nothing can be truly 100% guarded, but if you don't aim for that aspect, you truly are going to leave a lot of vulnerabilities and holes in your environment. And the other question when relating to SaaS or virtualized environments is whether or not you're doing hosted or self-service. So now you're going out and you're acquiring services from another organization to go out and provision these things for you. So what if there is a breach in their data center? What if there is a breach on the application side? How do you know and how do you mitigate these issues without compromising the private data that your clientele so dearly holds value to? Also, now you're talking self-service as well. So if you're hosting in-house or you're designing it in-house, are you truly building in the security model that one mirrors your current security model, and have you visited your security model lately? When was the last time that you looked at your security policies and your acceptable usage policies by your user base? This meaning clinicians, physicians, and anybody in between, and have made sure that you have an up-to-date, cohesive policy that mirrors today's technology requirements. What security model should cloud usage follow? We kind of just touched on that. Does it actually mirror what you have in today's data center in-house? You have to take a look at that, because if you don't, you may be setting yourself up for open gaps, some issues down the road with, well, it's not in our acceptable usage policy, and the UAP doesn't necessarily cover cloud access or these fringe device access. It may be ambiguous or maybe too vague, and in the end of the day, if there is an issue, how do you protect yourself when governance comes crashing down on you because that wasn't something that was looked at? Again, this type of security may be similar to the data center, but it's still different. You're talking about different paradigms. You're talking about virtualization. You're talking about cloud access, anytime, anywhere, on demand. Do you have the staff? Do you have the people to look at that, to look at breaches, to look at security concerns 24/7? My guess is that would be no. It's difficult to maintain in today's usage space, where you have a physical data plant, where you have a physical, desktop or PC. Those are difficult enough, let alone to try to address mobility as a new entity within your enterprise. So what do we do? One, I think you have to look at it, and you have to start aligning your security goals across your organization. And what that means is whether you're in the dental side of things, or if you are in the ER, or if you're in pharmacy, you have to have buy-in from all of the different groups and the different champions of those groups to develop a cohesive, a strong, a centered security policy that will help deliver and also address today's concerns, including mobile devices. Because mobile devices don't just live, in one specific area. While it may be true that you may use them for your pharmacy, you may very well be needing them in the OR, and you may need them, down the road with the technicians. These are things that need buy-in, one driven from the top down, and then that helps deliver and guide the premise of how security should be driven within the enterprise. You have to look at the additional capacity and how much capacity are you actually filtering and using on these edge devices. You have to make sure that once you have implemented that the end user experience is not degraded based on whether it's a mobile device or it is a static desktop device. You must plan for greater elasticity. How quickly can you select ramp up to meet your needs? If you are hosting or if you're doing in-house. Flexible bursting, how fast are you able to access additional capacity? You have to look at these things from a data center inwards out. Because no longer are you just, again, securing the enterprise. You are now securing outside of the enterprise, fringe devices. Sort of like when VPN first was initiated, a lot of the questions were, well, how are we going to make sure that these devices are, not going to do anything within the environment? Well, they were corporate or enterprise-driven devices that were provided to the fringe, in the forms of laptops, and those were easily tracked. But now you're talking about BYOD, bring your own device, and that's not so easy. Healthcare mobility and security. Now here's the meat of it. What should it be? Device agnostic, providing security at the user profile level. So now you're assigning access and privileges and roles driven based upon where the individual lies in the organization and the services and applications for which they are entitled to have access to. Easy to use, provide SSO, single sign-on, very key. Nobody wants to run through 15 passwords, especially if you're on a tablet or if you're on a small smartphone. It's cumbersome enough to enter user credentials in those devices. If you have to do it once, that's probably the best way to go. And access from any device. Application control, unfettered access to all applications should be discouraged and monitored. You wouldn't release, you wouldn't have your entry-level personnel access to your financial data records or your EMR records. You would want them to have access to maybe just the data entry points for which they are entitled to. These are the things that sometimes bog down security implementations in any regards, is the access. What level of access should your personnel receive? And at times it can be difficult because if your security model, for one, is way too tight, then you're restricting everything. If it's way too open, now you've opened up the keys to the kingdom and given the keys to the kingdom to everybody, and now you don't have a way to remediate that, because once you drive down that path, it is very difficult to get out. And I have been there personally, where I have been in environments that have been preset with open architecture. Everybody has access to everything. And then when you start pulling back on the reins, unless you have complete buy-in from all the organizations, it becomes a nightmare to try to pull that back. Access control, controlling access at the edge and establishing access control to the remote data points. This is especially key when you're dealing with mobile devices and devices that require access from the fringe, especially whether it be a laptop, be a smartphone or tablet. You have to look and seeing what access should they be given that they are out at the fringe. Now, those privileges may be different when they're inside the building and they're using their desktop. Certainly, these are parameters that need to be predefined and preset and understood by your user base, so that when they're sitting behind their desktop and they have access to certain items, and they leave and they're doing other items and they're not necessarily required to have that level of access at the fringe, that should be understood, because now you're predefining the user experience, and they're not already setting up, well, why don't I have that access? And now you have a political fight on your hands. So let's talk about hardware, software, and what is required to drive such a security entity. Again, you're talking about device-agnostic client for access and profile management. Again, something that can sit and reside on your end fringe devices that, one, won't interrupt access, two, one, won't get in the way of the performance and the processing power of the device, and three, one that provides ample security mechanisms in the event that there was an issue with the phone, in the event of loss, theft, or destruction. Client security gateway for profile management and client termination. Obviously, these devices need somewhere to go to talk to. They need to talk to a certain device in order to make sure that they have the level of authentication and requirements to garner access into the environment. Again, you also need a firewall for policy enforcement and security zone segregation. This is important because you want to make sure that all your security zones are in different buckets. That way, you do have both a physical and logical segregation and separation of the data. which is very critical for HIPAA. SSL VPN for remote user access and provisioning of access to remote nets, services based on roles. Again, you are assigning criticalities to an individual based on their location in the organization. The SSL VPN will further garner and allow you to publish those expressly implied resources to that user in order to make sure that he doesn't have access to anything else. You're further tightening the bolts, but not limiting the access. Then we get down to UAC, Unified Access Control for Security Policy Enforcement. Again, this is a 802.1x premise that you're adding on top. It's an overlay. Basically, you are asking another device to go out and poll and make sure that they have access to what they should have access to. You are verifying their credentials against AD or LDAP, and in that case, you are filtering that information down to the SSL VPN. Again, going to the firewall, making sure that they're allowed for that policy and for that security zone, and then your client security gateway allows access to that profile. At the end of the day, what we're talking about here is Juniper's Mobility Security Secure Clinical Mobility Network. So access to EMR, medical imagery, clinical systems, and ambulatory systems. Be a clinician that can use a device of choice, whether it be a physician or what have you. Doesn't matter who the individual is, so long as they have the credentials and the appropriate levels of access, they are able to access via this service all of the necessitated applications and required services. So basically, access critical patient data at point of care, access to critical information that enables better care decisions, secure access to network applications and data anytime, anywhere, and you enable this BYOD culture. Let me further strengthen that. Let's go down deeper on the enable BYOD. You are now furthering securing the BYOD culture. So not only are you an enabler, but you're also securing. By doing that, you're allowing a peace of mind for those that sit up top in upper management and have to engage with regulatory compliance, that they are doing everything possible to make sure that the critical information that is patient information is not leaked, or that critical information which may be PCI compliance from a credit card and financial aspect is being protected. Things to consider when you're using mobile security. You can use alternate credential schemas tokens, completely control password policies. You can implement internal password resets. Now, all of these things are pretty much things I'm pretty sure you guys are fully aware of. Perform an anomaly detection on login attempts such as an IDP, or if you have a SIEM device, place a portal behind a VPN, access control, endpoint management. But when you think about that, that has a lot to do with a lot of different devices and not necessarily all in one cohesive state. Some of the recommendations that we have are you create strong policies on quality and rotation of your passwords. Employee education, number one thing that I always preach about, whether or not you're using mobility or static or what have you, employee education should be paramount in your organization as far as delivering security information. It has to get out there. You have to instruct the employee on how this is helping and not hindering. Many times security deployments go awry because the employee is not fully educated on the benefits of what's been implemented. And furthermore, a lot of times the employee is completely unaware that these initiatives are being employed. So when they do get rolled out, they give you the what is going on here look, and basically you end up with a little bit of an uprising. It gets quelled over time, but unfortunately you still don't have immediate buy-in. It's much easier if you have that immediate buy-in, and employee education is the key. Try not to reuse credentials. I've been in many different locations and many different customer sites where I'm walking and I can see credentials posted on monitors. I'm sure everyone has seen this. Credentials posted on monitors, on the keyboards, under the keyboard, or they've written it down and it's on a postie and you can still see what was written on the postie. Or they use very lax passwords, such as the name of the dog, their children, what have you. These are things that need to be, again, brought to the forefront of their collective minds, addressed, and then instructed on how to easily change. Because I know part of the issue is when you reissue credentials, it's always hard to remember, and that's where we get into the problem again. Let's tack it onto the monitor because I don't want to forget. Instruct on anti-phishing techniques, not falling prey to the spammers of the world and using, you just won $5 million. Can you send me a check for 300 so that we can cash this out in in some bank and who knows where. These are things that, again, can proliferate to the end user in the fringe devices, especially if you're not only using it for work. If that device becomes also a personal device, there's a lack of control there. So you don't necessarily have access to or know what email client are they using or how many email accounts are they using on that one specific device. These are things that you have to look at and have to address. And if you don't, then you need a mechanism to help guard that, especially when they're accessing the environment. You can use off-site SSO if available, and consider additional restrictions using VPN and map to what protections you had. Again, if those protections you had were valid for the technology that you're employing today. If you're not ready for this paradigm, or you're not prepared, or you haven't thought about it, you're probably likely run into the following problems as it relates to mobile security. One, static. Manual configuration and management of your remote user and mobile devices and security infrastructure will probably not scale with the demand. If day one you have 20 devices and you're like, oh, okay, that's simple enough. Let me have the 20 devices. Now word of mouth spreads. You can bring your own device, or it's been mandated. Hey, have at it. Now your IT infrastructure is going to kind of come under a burden because you have so many different types of devices. One, you have to learn what each device does and how it does it. Two, you have to become accustomed to how it accepts updates and how it accepts security parameters. And three, you have to accept the fact that loss in a mobility world is a way of life. Someone is going to lose a device, and who knows what information is on that device. Is it manually stored there, or is it automatically offloaded to some cloud service? The frustrated user base. If the device is too cumbersome, if the security parameters are too locked down or haven't been made readily available so that the end user can understand, they become a frustrated user base. Poor performance will lead to the scrapping of security initiatives and possibly table future ones. When you have an uprising like that and you have business units that weren't necessarily on board to begin with, and all of a sudden they get this pushed down to them. And I've seen this firsthand where an initiative gets pushed down and they necessarily don't buy into it because it either affects their sales unit, it affects one of their other business units, increases help desk tickets. Then you have an uprising, and you have basically a lot of people clamoring and becoming that squeaky wheel that goes up to the CIO, CTO, and next thing you know, you're being told, make it work. I don't care what it takes, make it work. And when that happens, that is not a good place to be. Because again, now you're talking about security compromises. Now you're saying, okay, I'm only going to leave the fence closed for half a day, and the other half of the day it'll be open so anybody can come in and out. So basically you're creating an atmosphere of workarounds and poor adoption rates that will only serve to reduce the effectiveness of the newly installed solution and thus reducing your ROI. And we know at the end of the day, with the bottom line and with the way healthcare is today, as far as all of the different regulations that are changing, there's some uncertainty as to how all of this is going to roll from a money standpoint. And the reduction of revenue based on the increased services that need to be offered based on today's governance, you're going to have a difficult time keeping up with the Joneses because your newly implemented services are losing value because they're not being used. And we don't want to see that. We want to make sure that, one, you're able to enable your user base. Two, make sure that you're within compliancy statutes, whether it be HIPAA or PCI. And the other reason is that you want to make sure that you protect the back end of the patient information. You want to make sure that they're not compromised, because otherwise you have another level of problems there if their information does become compromised. So we kind of touched this on this a little earlier. What about the back-end security in the cloud and the data center? When you use mobile devices, there's application and content delivery that needs to happen. And in some form or fashion, there needs to be some level of access that is required of the back end, whether it be a database, it could be Oracle, SQL, or what have you. It could be some type of EMR, CRM product that you need to access, or patient records information that you need to access, or some homegrown application that you might have that needs to be secured but accessed. Devices. But you're not doing yourself a favor if you're not looking internally as well. You have to have a complete end-to-end solution to make sure that you have as much of it covered and to have a reduction in gap. And by that, you're looking whether you're implementing some sort of Citrix or VM or some sort of virtualized environment. Whereas virtualized environments are the de facto for cloud and application-based delivery these days. Why? It's easy, it's fast, and it allows for a certain sense of disaster recovery. When you're talking about virtualized environments, you're able to produce your servers, re-image your servers here and there, and re-image user base, user desktops, laptops here and there by just capturing your image and moving it off to a different server or what have you. But what happens to the server itself? Now you're talking about the iron, and the I/O ports are being protected by firewalls and IDP on the outside. But what about on the inside? Do you truly have a level of visibility into the virtualized environment? And this is where many get into trouble because they don't. They might have otherwise access to the I/O to the outside, but not to the. So you also need to maintain the self-service factor, or you risk torpedoing a significant part of your value proposition of your VM and cloud implementation. Again, that goes back and addresses am I really protecting my VM implementation, or is it all a charade I'm just protecting on the outside? Again, I'm not trying to create a false sense of insecurity. It's just more or less these are the paradigms, these are the things that will be cropping up as more and more people start garnering or looking for access, and as those on the outside, those with nefarious and malicious ideas, might be looking to get after this information. Because not only are hospitals a great mining source for information, but they're also a great mining source for patient credit card information. So again, you've now secured your edge. What about your delivery mechanism? VMs and virtualized environments can be targets for both malicious and financial gain. Who's guarding the kernel? There are aspects and appliances and devices that say they can look at VMware or virtualized environment and secure that. That's fantastic that we are now addressing these needs. However, it's easier to manage one solid cohesive system versus going out and getting this piece, that piece, and trying to make it all fit together. Again, there are tools available and emerging that can address some of these needs. How do you recognize the need? If you're subject to governance, you have a need. Bottom line, yesterday's solutions will struggle to keep up with this demand, and we kind of talked about that. Just putting a firewall in front and saying that you're okay, or having IDP, or even a SIEM, a security information event management core, nor will it mean that you'll be able to capture all the information that's going on. You're likely to find that you're going to want basically a single pane of glass, a unified platform to deal with both the build and the runtime aspects. This includes access and control and application delivery. But not only that, being able to stop it in its tracks in the event that there is an issue. So This slide here kind of covers the full Monty as it relates to the Juniper security model for both mobility and virtualized environments. On the left-hand side, we have broad coverage for mobility, which covers Junos Pulse, the mobile security suite, the SSL VPN, SA, which is basically the SAs, the SSL VPN, the appliance, the MAG series, UAC, and SRX. Now, I know they look like a lot of devices, but did you know that the MAG series can house a lot of those devices in one single platform? So that way you're not having to have 5 different appliances. You have basically 1 to 2 appliances that you need to manage. Flexible deployment in the cloud. Again, reusing the stuff that you have on the left, you're looking at Junos Pulse and SSL VPN for that access, UAC to monitor and authorize that access, SRX series to police the access, and now we get into the virtualized environment with BGW, watching the kernel. Who is watching the state between the servers inside the VMware session? Storm series for security information event management, and the MAG series, which again you can use as a single platform to house many of these components. And then you get security content and coordination at the hospital, at remote clinics, whether or not you have the need for Junos Pulse. Again, at the remote side, you can implement one of the MAG series to bring in Junos Pulse, the SSL VPN, the gateway for your remote access, and then you have a separate box for your Storm, or you have it reporting back to central, to the hospital for the services on the Storm, and then you have Junos-based security design, basically allowing access and monitoring of all of these devices, and then opening up tickets in the event with JTAC if there is an issue. This is basically the security model for which Juniper has had the forefront to go out and look at and understand the needs of the environment, not just from an enterprise-wide, but also from a healthcare aspect, because we understand a lot of the different components that are required for healthcare and HIPAA and PCI compliance, and we've brought them all together so that, one, you don't have to piece everything. You don't have to go out and get XYZ organization, XYZ or ABC over here and 1, 2, 3 down there, and then try to make it work and piece it together. We at Juniper, along with Structured Technologies, we understand what it is required in the healthcare industry. We have serviced the healthcare industry for quite a few years, and we are in the middle of a major implementation as well, employing many of these resources that you see on this screen. Again, you have to understand it's easier to manage end to end when you have a single pane of glass. And doing that using the MAG and the Junos Pulse on your edge devices will help simplify and help you understand what is going on in your environment. We talk a little bit about Junos Pulse and some of its features when it comes to the edge device. So when you have myriad of devices such as an iOS-driven device or an Android-based device or a smart device with Windows, it's hard to keep a finger on what is being used on those devices. With Junos Pulse, you have visibility, and with the Junos Pulse Gateway, you have even further visibility, one, in the applications that are installed, two, whether or not they have a virus or malicious activity going on. So basically, you're adding antivirus, you're adding IDP to that device, and three, you're using credentials also, access via SSL VPN into your services. And then when they come in, your SSL VPN is able to, one, publish directories and information that are required for that particular user. Your Pulse Gateway is authenticating against the UAC and providing that secure tunnel for you to be able to access that information. And the SRX series is policing everything that's going on in the environment and making sure that the zones are not compromised and they are being remediated if required. The other aspect of Junos Pulse that I really love, and this is when a device gets lost. Again, mobility and loss go hand in hand. It is just the way of life. At some point, you're going to leave that phone or that tablet at the coffee shop, at the movie theater, or maybe at the patient's house. What happens? What can happen in that hour to 2 hours that maybe it takes you to realize that your phone is gone, or that it takes you to get to that device? Did somebody try to access it? Did somebody try to pull information off of it? Or did it fall down a toilet and then it became a brick? What do you do? With Juno's Pulse, you're able to scrub that device of all pertinent information in the event of such incidences. Also, you're able to locate the device with location services on that device. So, that being said, with the single pane of glass and cohesiveness, you're able to maintain, manage, and govern what is happening with that device, and helping you ensure that your healthcare mobility security implementation is as clean as possible. I leave you with this. According to a recent study, healthcare practitioners are relying more and more on mobile devices, as 4 out of 5 physicians say that they will rely on their smartphones and tablets to access, retrieve, and submit sensitive patient medical data, with over 80% of doctors using mobile apps every day. Further, more than 25,000 mobile healthcare applications are in use today, with millions of downloads collectively. The healthcare industry is faced with new reality. Healthcare applications are impacting mobility. Professional applications for caregivers are giving BYOD, and hospital authorized applications are enabling access to clinical services. This is the truth. This is the reality of today's healthcare paradigm. It is moving that direction because the rest of the world is moving in that direction as well with mobility. Aching to when the laptop first came on and people didn't think it was going to take quite foothold, that it was much more of a novelty. This, again, is not a novelty. A novelty is having something last for a couple days, a couple months, maybe a year. This has been going on for several years, and it keeps growing in numbers and numbers and numbers. And I don't see it ending anytime soon. So, the next thing we have coming up is Tuesday, April 17th from 10 to 11 a.m., Securing the Virtualized Explosion. This will help address also further needs on guarding with virtualization and how it impacts your usage for mobile devices as well as cloud-based initiatives. Join us at on the 17th for this free webinar, if you will. If you have any questions, please feel free to address me directly at david.d'antilles@structure-tech.com or visit us at www.j-solve.com.